Mumps, as a disease, has been known since ancient times, with descriptions that resemble mumps found in writings from the time of Hippocrates, the ancient Greek physician, in the 5th century BCE. However, the identification and isolation of the mumps virus itself occurred much later. The mumps virus was first isolated by Dr. Claude R. Johnson and Dr. Ernest William Goodpasture in 1934. This significant advancement allowed for further studies on the virus, leading to a more profound understanding of its behavior and eventually facilitating the development of the mumps vaccine by Dr. Maurice Hilleman and his colleagues in the 1960s. Mumps is a contagious disease caused by the mumps virus. The route of infection and transmission for mumps is as follows. Respiratory droplets. The primary mode of transmission is through respiratory droplets when an infected person coughs, sneezes, or talks. Direct contact. Transmission can also occur through direct contact with an infected person's saliva or mucus from the mouth, nose, or throat. This can include activities like kissing or sharing items like cups, cutlery, or toys that have been in contact with an infected person's saliva. Touching contaminated surfaces. Infected droplets can land on surfaces, which, when touched by another individual, can lead to infection if that person subsequently touches their mouth, nose, or eyes. Entry and spread. Once the virus enters the body, typically through the mouth or nose, it first replicates in the upper respiratory tract. From there, it enters the bloodstream, viremia, and can spread to various tissues, including the central nervous system, pancreas, testes, and ovaries. Its primary target, however, is the salivary glands, especially the parotid glands. Symptoms development. After an incubation period of about 12-25 days following exposure, an individual may start showing symptoms, with swelling and pain in the parotid glands being the most characteristic. Infectious period. A person with mumps is most contagious from about 1-2 days before the onset of parotitis, swelling of the parotid glands, to about 5 days after its onset. Therefore, it's recommended that individuals with mumps be isolated during this period to prevent further spread of the virus. To prevent mumps infection, vaccination with the measles, mumps, and rubella (MMR) vaccine is recommended. This vaccine effectively reduces the risk of mumps, as well as the 2 other diseases it covers. Mumps is a viral infection primarily known for causing swelling of the parotid salivary glands, which are located just in front of the ears. Here are the primary symptoms of mumps. Parotitis. Swelling and pain in the parotid salivary glands are the most characteristic symptoms of mumps. The swelling can be on one or both sides of the face, giving a person a distinctive, chipmunk cheeks, appearance. The skin over the swollen gland may appear reddened or feel warm to the touch. Fever. Many people with mumps develop a fever, which might be the first symptom. Headache. Headaches are common in people with mumps. Muscle aches. Generalized muscle pain and discomfort might be experienced. Fatigue. People with mumps often feel tired and weak. Loss of appetite. There might be a reduced desire to eat. Pain while chewing or swallowing. Due to the inflammation of the parotid glands, it can be painful to chew or swallow. While the above symptoms are the most common, mumps can also lead to complications in some cases, which can be associated with their own set of symptoms. Mumps is a viral infection, and there's no specific antiviral medication to cure it. Treatment for mumps is primarily supportive and aims at alleviating symptoms and ensuring the patient is comfortable. Here's how mumps is typically managed. Isolation. Since mumps is contagious, it's recommended for patients to stay isolated to prevent spreading the virus. Individuals with mumps should avoid school, work, and public places from the time of diagnosis until at least 5 days after the onset of parotid gland swelling. Pain relief. Over-the-counter pain relievers such as acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, can be taken to reduce fever and relieve pain. Ensure they are used as directed and are appropriate for the patient. E.g., aspirin should not be given to children because of the risk of Reye's syndrome. Warm or cold compresses can be applied to the swollen glands to help reduce pain. Rest. Plenty of rest can help the body recover faster. Stay hydrated. Drinking ample fluids, such as water, soup, and fruit juices, can help maintain hydration. Soft diet. Because swollen salivary glands can make chewing and swallowing painful, eating a soft diet can be helpful. Suitable foods include yogurt, mashed potatoes, cooked cereals, and soups. Avoid acidic and spicy foods. Acidic or spicy foods and beverages, like citrus fruits or juices, might irritate the salivary glands and should be avoided. Regular hand washing. To prevent the spread of the virus to other members of the household or caregivers, maintain good hand hygiene. Inform close contacts. Informing close contacts about the diagnosis is a good idea so they can be vigilant about symptoms, especially if they're not vaccinated or unsure about their vaccination status. Monitor for complications. While most cases of mumps resolve without complications, some patients might develop more severe issues, such as orchitis, inflammation of the testicles, or meningitis. Seek medical attention if symptoms worsen or if new symptoms develop. Remember, vaccination with the measles, mumps, and rubella, MMR, vaccine is the most effective way to prevent mumps. The vaccine has significantly reduced the number of mumps cases in countries where it is routinely administered and can prevent both the primary infection and its potential complications.